Так, шановні колеги, чути мене?
Dear colleagues, please confirm that you can hear me. Great, amazing. So first of all, let me welcome you at this venue. This is a Congress of Professional Medical Associations, and it's a rare event. The last one happened 4 years ago. I'm sorry that I cannot join you in person and I have to join you online. But unfortunately, I just returned from a professional European Congress, so fresh from another event. By the way, directly related to our topic, self-governance of medical associations. Our first panel discussion is about the role of self-governance in development of healthcare professionals. So if you don't mind, let me add a few words about the subject matter of our today's discussion. So we have talked about it for a long time, since 1998, but the progress in this area has become apparent only when we resumed proactive active work of the association itself. Initially, we thought it would be sufficient to establish institutions, which has been done, although it wasn't that easy. Obviously, it was not enough. Then we hoped for the draft law. Uh, Hello, dear colleagues. We're happy to welcome you today at the National Healthcare University named after Platon Lukic Shupyk. And today we have come together for a congress of members of Ukrainian Federation of Professional Medical Associations, which happens as part of the third International Healthcare Summit. So, the summit and congress are now officially open. Let's play the Ukrainian anthem.
Дякую.
Thank you. So we're about to start our today's event with extremely relevant and exciting topic. Probably it will be interesting and helpful for entire healthcare community and all healthcare professionals. And specifically, we're going to talk about the role of self-governance in healthcare professional development. And today, we invite you some interactive exercise. So, in order to make sure that our speakers can interact with you and listen to your voice on various issues regarding development of healthcare self-governance, we invite you to join the activity. Now our technical team will show a question on the screen. When you registered, you have received voting remote controls, and I will kindly ask you to share your opinion. So please vote for those self-governance mechanisms you believe to be the most relevant for improving the quality of medical services. Please vote.
Дякую.
Thank you. So, as we see, most people have voted for professional attestation and certification of medical workers and development and introduction of clinical guidelines, internal audit and collective control. And so, dear speakers, please share opinion during your presentations. Now, question 2, please. What of the challenges today creates the most barriers for development of efficient medical self-governance in Ukraine? Please vote, please share your opinion. Thank you, dear audience, for your votes. So, as you see, absolute majority believes that the key challenge restricting the development is limited funding and resources, low motivation of young healthcare professionals uh, ranks second, and imperfect legislative framework is top 3 challenge. Today we have members of parliament, members of the parliamentary healthcare committee, so we'll have a chance to discuss it. In place question 3. What are some of the tools which will be the most efficient to engage young professionals into medical self-governance activities? Please feel free to vote. And as you see, today in this hall we have a lot of young professionals. Uh, Resident doctors, young doctors, so we appreciate your opinion. Thank you, we appreciate it. So, as you see, most people have voted for international on-the-job training and grant projects. Today at our summit, we will have a second panel about international collaboration and international research. I think it will be interesting and exciting for you. And another important thing, career opportunities through self-governance systems. Thank you so much for your voting. And now I kindly invite Mikhailo Borisovich Radutsky, Member of Parliament, Head of Parliamentary Healthcare Committee. Please, Mikhailo Borisovich, the floor is yours. Hello everyone, and before we proceed with the main question, I want to express my sincere gratitude. Thank you for the work you're doing today during the war, and your efforts during COVID. Thank you for doing surgery in bomb shelters. Thank you for saving lives under shell fire. Thank you for bringing our defenders back to life and saving our civilians despite shellfire amidst full-scale invasion. Please accept my sincere gratitude. It's impossible to overestimate your contribution. The work of healthcare professionals today, sometimes my colleagues get offended that I say that armed forces and healthcare workers rank the most important in our efforts towards the victory. Actually, today our healthcare system is a flexible system which adapts to our existing environment. Limited funding, because today that every hryvnia earned by Ukrainian budget, 97 kopecks cents are spent on the national security, and additional funding received from our partners is prioritized for defense and military purpose. So this remaining 3 cents plus additional support from our partners is what remains for healthcare. We're struggling indeed, but nevertheless, we're successful. I mean, the presidential team, the government, and the parliament are successful to add something to medical budget year to year. As you know, probably my colleagues in parliament will vote for it. So for next year, we plan almost extra 50 billion hryvnias for healthcare system, for medical guarantee packages. It will be the first year, as I think it's a great achievement. We plan to introduce in Ukraine checkups after 40 years of age. They will be mandatory for healthcare professionals, won't be mandatory for patients, but doctors will be obliged to offer it. It's not because it's not about populism. It's about rational use of resources and spending in the future. That's how we can avoid expensive treatment of cardiovascular conditions, cancer, diabetes mellitus. That's how we can reduce disability rate. Because you understand that if a person with a stroke does not receive timely treatment, it results in at least disability. I mean, disability in the best case. Heart attack, similar thing. Diabetes mellitus, a person will be dependent on insulin for a lifetime, and multiple comorbidities may develop due to diabetes condition. Cancer. Probably I don't need to tell you about potential outcomes of cancer conditions detected at a later stage. So the earlier we identify these conditions thanks to regular checkup, the better it will be. Today there are many technologies that allow to identify conditions, health conditions at the family doctor stage without the need to reset secondary and tertiary stages of levels of the healthcare system. Many things today can be done through digitalization, through those existing tools in the toolbox of family doctor. Some programs will be added there, while even description of ECG can be done by computers. And if there are no findings, you don't need an appointment with cardiologist. But still, we do insist, and I hope that next year we will succeed. Of course, we cannot reduce the rate, but we will definitely introduce coefficients for doing timely examinations and zero complication rate among declarant patients. The same is true for secondary and tertiary level. The government is working on it, the committee is working on it, and I hope that sooner or later this issue will be addressed. So our today's topic is extremely essential for me. Why? Because when you open social media and you read posts by a healthcare provider, X is not done, uh, A is not done, B is not done, chief medical officer is bad, minister is bad, committee is wrong, everything is wrong. But as soon as we say, 90% of things you don't like can be done for yourself. You don't need to delegate these powers to the government. The government is ready to delegate these powers to you. But once again, I don't want to sound offensive, but immediately when we start talking about it, there were at least six, I guess, six draft laws registered with the parliament on medical self-governance, and except for one draft, four of them were about absolutely different things. By the way, I also voted in it too, and I look at the percentage. Actually, my opinion was pretty similar to yours. So the most important in this draft laws is who's in charge. They're not about development of use. They're not aimed at certification. They're not aimed at introduction of ethical boards. Everyone is satisfied with the situation where someone at the Ministry of Healthcare will assess the quality of surgeries done by neurosurgeons. Well, neurosurgeons are supposed to assess neurosurgeons, isn't it? Aren't they? Definitely, you don't need someone at the ministry or at the department to decide on whether you receive a certificate or license or not. No official is capable of doing it. This person can be highly experienced in public administration, but they definitely not medical practitioners. The community of medical practitioners will always prevail in this regard. And once again, I don't understand why in the United States of America the Ministry of Healthcare requests assistance from self-governance party rather than vice versa. It also happens in the European Union, so why do we abandon this concept in Ukraine? Today I see a honorable and respected audience in front of me, and Mr. Vyacheslav let me know that today we have delegates from over 200 associations. So how many associations do we need to establish to assume the powers held by the government right now, given that the government is willing to delegate them? Officials are bad, so take powers away from them, reduce their number. Departments are wrong, take away their powers. Chief executive officers, chief medical officers are wrong, okay, take away their powers. The government is working on the new law now. The six draft laws failed in the parliament. There is no draft law introduced by the government. It has passed the first reading. I won't even name the number of amendments introduced by various stakeholders. I mean, this particular draft law. And no amendments are about right of neurosurgeons associations. Neurosurgeons, please don't be offended. I'm not talking about you specifically. It's just an example. So let's stick to it. So it's not about powers of neurosurgeons, cardiologists, and cardiovascular surgeons, but it's once again about who's in charge. It's about who's going to be a part of management board. Come on, self-governance is not supposed to depend on our mentality. You know, what people says, in a group of two Ukrainians, there will be three leaders. Unfortunately, people fail to reach consensus. I mean, leaders, people who held unconditional authority as practitioners and researchers, people who own experience and expertise cannot reach a consensus. They keep arguing who's in charge. And you know, we had a draft law proposed by a committee among the sample of Z6. So someone once said, what do you mean people are going to click a button in a D application and pick a president of the association? Come on, we can vote for the president of Ukraine. We can vote for members of parliament, we can vote for members of local councils. So why cannot we vote for the leader of a medical self-governance system? Why? Don't you trust dear? Okay, we can do just a physical bailout, we can go back to 20th century. But why should we do it? That's just my question. Someone may say, why doctors are supposed to pay membership contributions? Like, come on, every association has membership contributions. Here we have our friends and colleagues from the United States. Is the medical self-governance funded from the state budget in the United States? Of course no. They make government stay away. Maybe people from the government would really love to participate in self-governance, even through fundings, but healthcare professionals don't let the government even close. You know, now we're launching a project in Ukraine together with the University of Illinois, an exciting project indeed. And as part of this project, a lot of healthcare professionals, a lot of beneficiaries are required. And someone said, a professor of University of Illinois says, how can I keep in touch with Self-Governance Association of Cardiologists to do a presentation for them? So they allow the department, they allow the Ministry of Healthcare to run this pilot. You've heard it, right? The professor of University of Illinois wonders how to negotiate with the self-governance system of Ukraine. You know, I felt so embarrassed when I had to tell them that there is no self-government system in Ukraine. He showed me how there in Illinois it once took 6 months for the state of Illinois to negotiate with the self-governance to run a pilot, and this pilot is not about clinical trials. It's absolutely administrative thing. So Kennedy Jr., this person from University of Illinois, had negotiated for 6 years for self-governance. So who holds the power in the United States? The healthcare community or the ministry? So here we suggest to do the same. Each and every one of you is a personality, unique personality, and you definitely qualified in your trade and your community, and it's up for your community to decide how it's going to be. Look, today we have expanded the Ministry of Healthcare through some extra funding. Today we have expanded the list of accessible medications. I'm looking at it and it seems fine to me, but it's up to doctors to say, well, look, maybe we need 14 different cytostatic drugs and spend the rest of money on diabetes drugs. I'm just making it up for the sake of example, but it's up for self-governance to decide it together with the Ministry of Health. The government allocates funding, but you're the ones who treat patients. We don't want you to be the slaves of your medical directors. It's about licensing. You need to have your own independent professional item. It's a license. It's a fundamental thing, because when you have professional independent license, you cease being dependent. Then you can work at 5 operating theaters at one time, at a district hospital, at a university clinic, because you have your own license and no one can ban you from doing it. So if a patient wants Dr. Kaminsky to do the surgery, Dr. Kaminsky, who holds his own independent professional license, is absolutely free to do this surgery. No one can prevent him. He can just sign a contract. Yes, it's also about responsibility, because now you're responsible through your license. But you know, benefits always come with responsibility. Once again, when you have your own license, you can be individual entrepreneur. It may look wrong on the surface, but otherwise, today the National Health Service of Ukraine pays individual entrepreneurs similarly to regular hospitals. You don't need to hide anymore. I once asked academician Fomin, why don't you come to a private hospital? He said, look, at your private hospital everything goes to the cash register, but I really love gratitude from patients. He said, some people do offer, it's a quote from Mr. Fomin, unique individual who did unique surgeries, and unfortunately many of his achievements cannot be recreated today. But once again, self-governance enable professional practitioners like him to follow their own agenda and pursue their own interests. No one will go to private health care. Lviv is a good example. Lviv Perinatal Center. I personally received phone call and asked me to recommend, when people ask me to recommend a good clinic for delivery, I always recommend Lviv because they are much better than everything available in Kiev. And it's not because they receive more funding. It's because of leadership. It's because of competent healthcare team. And when I saw people in a bomb shelter speaking foreign language, I once asked them who these people are. She said, these are people from Poland. What they're doing here? They're doing genetical research because in our country, our genetic labs are better. So for some reason, Polish people come to Lviv regardless of damage and regardless of missiles. Just imagine a missile strikes Ahmadid while children from other country are on a surgery table. So you are self-made people. All of you have at least one patient who is somehow related to government, to parliament, someone's family members. Write a draft law. Help us to write a draft law. Maybe some amendments before the second reading. Let's introduce amendments. But I don't want any more amendments about who's in charge. If this is the only thing you care about, let's just keep this draft law as it is. Maybe the new cohort of members of parliament will do it. But if you want to become more independent, if you want to become more influential, if you want to bring in more young doctors, we want a transparent future for young professionals. We don't want our young professionals to join Polish, American or German self-governance. We need them here and now. So I kindly ask you to support us. You're doing a lot. I know that your federation will soon join the European structure. Your voice will be heard in Europe. But the first question you will be asking Europe is who's responsible for self-governance in your country? Is it approved with your self-governance system? And we have no one to approve it because we don't have self-governance. It's terribly bad and it's very challenging, especially in light of our Euro integration aspirations. Thank you so much. Now I would like to give the floor to Vasil Vasilyevich Lazaryshin, Professor, Director of Amosov National Institute of Cardiovascular Surgery, President of the NAMSU, Professor, Medical Doctor, and President of Ukrainian Federation of Professional Medical Association. Hello, thank you so much. I'm happy to welcome you here in this hall during this is a truly remarkable event in the life of medical community. This event is truly remarkable and unique. And now I will kindly ask you to share my slides. Today we are about to talk about European Union of Medical Professionals and Ukrainian Federation of Professional Medical Associations. Here you see objectives and goals we have set for us today. Because we are responsible for medical profession, our purpose is self-governance of medical professionals. Doctors must become independent and autonomous.
So we have to have solidarity and responsibility. This is why today the activity of the board, of the committees, of the working groups, of the Ukrainian Federation in the self-governance area, it's in close cooperation with the Committee of the Verkhovna Rada and the Ministry of Health of Ukraine and the National Academy of Medical Sciences of Ukraine. So we need to have solidarity and responsibility that has to be aimed at improving the capacities, at improving the health of the public in general. And the ways there are understood, but the main thing is to make sure that we are responsible in solidarity of the employers, of the doctors, of the providers. They should be responsible for the outcomes. Today, it's extremely important to cooperate. Cooperation between the European Union, the UEMS, and the Ukrainian Federation. So the medical profession is supposed to remain the leader in defining the professional training. So it combines targets and tasks of these two organizations. Taking that into account, we are strengthening the cooperation with the key authorities of the European Union, and we are implementing the general models of strategies and requirements to the European model of professional self-governance. Therefore, our suggestions are the following. The international cooperation as the means of integration of informational also adaptation of the best practices of medical professional community. It should be based on the thesis of doctors' self-governance, of our taking care of this profession. First of all, we need to take care of professional self-governance, medical workers, and together we implement business activities in the sphere of medicine. The providers of medical services, then we are also oriented at certification of medical providers and management. Also, we are taking care of professional standards that influence directly the educational qualifications. Therefore, our suggestions, our proposals, and our manifest that we are going to adopt today. So the first argumented self-governed profession, it's protected with the complexity and it's an art. So the professions and arts it can't be ignorant, but the professional community, it should be transferred into the so self-governance of the profession and the professional community is the prevention of getting better. To support the application of the Ukrainian Federation of the Professional Associations regarding entering the European UEMS, this application, we are supported by numerous medical associations. Today, these are 97 of these medical associations in Ukraine that cover more than 80,000 medical workers. Therefore, I ask you to start the voting process and I ask you to support this initiative, to submit this application for the associated membership in the in UEMS. So you have the remotes. Please start the voting. People who are voting online can just raise their hands if they support this idea. Are we done? So therefore, you see, 80, 80 and 85% of participants support submission of this application to UEMS. Thank you so much for your support. Thank you. Thank you, Vasil Vasilievich. It's really a historical moment today. The summit supported this application. And in a few hours, the formal voting of the delegates will happen, and I hope they will also support this. And next week, officially, we will, to UEMS, we will send an official application, and I hope the Ukrainian Federation of Professional Associations will become the associated member as the most numerous medical community. Thank you so much for your support. Thank you, Vasil Vasilievich, for your presentation. And now we are expecting the president of UEMS, Professor Vasilios Papalois, or if the Professor Papalois is not here yet, he's also doing his shift in the clinic today. So he's our old partner and he's participant in our events. So when he's here, we will give the floor to him. But now I would like to ask Mr. Valery Zub, the People's Deputy of Ukraine, the member of the committee for the medical insurance. Please, Valery. Thank you. I would like to thank you for inviting me here. I would like to say that at this Congress, I am as the head of the Association of the National Association of Oncologists of Ukraine. It's one of the most numerous associations that is really working. It's really working in new directions. And I will be honest, when I went to work in Verkhovna Rada, one of the first desires that I had is to create the self-governance in the medical professions. This experience, I saw it in Canada when I was an intern there. Back in 2009, this is an organization that provides accommodation, that helps with training and education, with finding employment. So back then I was able to see that this is what we should have in Ukraine also. And I would like to say, as a head of this association, I visited all the oncological centers, and when we were preparing this law with the committee, I visited all of them, all of the oncology centers, and we talked about this everywhere. We submitted a lot of proposals, then these proposals were the basis for this ministerial law. I'm sure that we must adopt it, we must vote for it. Mikhailo Borisovich mentioned it. Unfortunately, the first reading it went through, but not the second one, but it's not our fault. Our committee is definitely for it, but there are certain people, for some reason, they don't like this draft law. So at this stage, it's been spammed, all these amendments, this is why it's being blocked. But hopefully it will be adopted at the end, and it will be so useful to all of us, to all of the community. And the Federation gathered most of the associations. It speaks about its power, its strengths. And the fact that we voted now, it should enter UEMS. Only the joint actions, the joint efforts today, we can implement something that our country needs, and just doctors need. This is our assignment of our association, creating protocols, legal support, help with the employment, etc., etc. This is what the association should be dealing with. So somebody who is doing the managerial decisions, they can't define how to treat a patient, what treatment schemes should be prescribed. The association should decide that. So together with Mikhailo Borisovich, we visited Lviv 3 days ago. There was an oncological forum there, and this issue was raised a few times. Everybody says the same thing. When we will have this opportunity? When? To take these decisions, like as a medical community, like the doctors themselves. So I think today it's a very historical decision being taken, and I hope that very soon on the legislative level we will be able to get this support. So to get prepared for this meeting, I looked at all the materials and I see a lot of representatives of associations here. They would say that they are ready to become part of UEMS. So coming here, I spoke with my board of the association. They all support this, that we all want to be united. So together, today we will have this right to vote, and all the representatives of other associations, associate members, they will also have this opportunity to be represented in this federation. Thank you. Thank you, Mr. Valery. Now, Mr. Sergei Obohov, the head of the Department of the Medical Education and Medical Staffing at the Ministry of Health of Ukraine. Hi. It's so pleasant to be here where I worked for so many years here. This is where I became a specialist, a professor. So I'm always happy to have such an opportunity. So I would like to congratulate you on this historical event, the results of the voting we witnessed just now. Back in 2024, we already started to implement this, like on the regulatory level, when we adopted the provision on the. So there is a regulation. The programs that are being developed, they should be in compliance with the standards of the UEMS. For us, it's very important with our Euro integration context, so that our education, Ukrainian education, will be acknowledged in the European Union. So in general, a few words about the development of the education, medical education, because this is my department, so the God sent me here to talk to you about this. We are in this medical university now. So this year, it's very important, speaking about the legislative and regulatory developments. With the support of the committee, in February we had amendments in the legislation of healthcare. On the 27th of September, they will come into effect. It's soon. So please pay attention. The new version of this article on healthcare, it's dedicated to regulation of the professional activities and also the training of medical workers. It's more precise, the requirements to the professional qualifications and the system of training in medical professions. We expanded and we specified better the powers of the ministry in this area, and also what we did it together with the committee at the legislative level, and also the sub-legal basis has been prepared. But the order 560, you all know about it. Now it's the same for everybody who works in the sphere of medical, for pharmaceutical professionals, for nurses, for rehabilitation specialists, for doctors. So the same nomenclature of specialists. It's very useful for us. Also, we adopted the lists of professions and specializations also in the medical area. Graduate and postgraduate education levels. So the peculiarities of these regulatory acts is that we implemented the notion of the professional qualifications. Now we understand what specializations on what level the training should be performed and what professional qualification as a result we will gain. So this is important for our system of education and the certification system. So please, dear colleagues, there is so much ahead of us. This is what we have already done, and there is also an initiative, a new draft law we are working on regarding the changes in the educational legislation to improve the clinical training of the medical students. So there is a lot of interesting things ahead of us. We will engage you into our discussions and cooperation, and I would like to wish you for this summit today to be fruitful and inspirational for you. Thank you. Thank you, Mr. Sergey. I think that we can move on to a little discussion with regard to the questions we voted upon. I would like the Professor Mykola Padanchuk to be the moderator. He's one of the people who inspired the medical self-governance. Mr. Mykola, please. Hi, dear colleagues. Thank you, Mr. Alexander, for being so effective in the moderation where I wasn't able to connect online. Only last night I came back from the European Congress, Toxicology Congress. So actually, it was one of the parts of this Congress. It was about self-governance. As an example, it's very fresh. 14 our toxicologists, they were given European certificates. What does it mean? A European Commission, the public organizations, federations of toxicology, associations of Europe, they gave the right, it's the only federation who get it, to certify, to attest their members. So when you get into the register of toxicologists of European Union, you have the right to work in any state or private organization. Not only in Europe, it's worldwide recognized. So to get the certificate, there are certain requirements. They are rather serious, but they coincide with today's requirements to the professional standards we are developing now in Ukraine. For 5 years, we have been getting ready for this, and 14 members of our Ukrainian community of toxicologists became members of the European Register of Toxicologists. It gives them the right to work in this experimental sphere, preventative toxicology and regulatory toxicology, not only in Europe, in the world. So this is what in practice it means, this work. It's non-governmental, but it's professional medical association. So this is what Mikhailo Borisovich stressed. So using his words, these benefits the association can give and self-governance can give, sometimes you can't really see them at a glance. But then I'm coming back to his speech again. This is responsibility. It's not about being the chief, the hetman, but the issue, most of the laws, they didn't provide for this responsibility of the members of the association and the association itself and the authorities that were created in order to govern those. So the law that was submitted as the parliamentary law, the federation got engaged at this design stage. And I must say there is a little but a very important answer to many questions that we heard today. So Article 33, it was added, they deliver medical assistance. It was only about medical staff that has employment contract with health institutions, but the committee agreed also to write civil legal relationships there. It wasn't there before, and this step is very important in order to use the benefits which Mikhailo Borisovich mentioned, like license. So apart from the license, such a doctor needs to have the grounds, same as chief. So the chief of the institution can use as doctor in the civil in accordance with the agreement. So our legislation, healthcare legislation, has to be improved, and the self-governance law is just a part of this, because outcomes, the consequences of this law, there will be legislative acts that will help us realize these rights and this responsibility, which we should take upon, the doctors with licenses should take upon. This is about these benefits, which are really this self-governance will give us. So it's been a long way. From 1998, the self-governance law in medical professions, it was looked into, and many versions were submitted. Difficult to name, to say how many actually. But honestly, not just the community and public in general, but even the medical community not always are ready to accept these changes. They don't understand. It's huge work on our part of the Federation, of the chiefs of associations, to explain what exactly will be changed in the lives and activities and professional realization of their rights for our doctors, for our medical workers. Now we see that it's a very long-term process. To take a foreign model, I can really tell you that I got acquainted with this for 30 years. In various countries, it works differently. So countries with market economies, they came to this through private practice, medical practice. Private medical practice to be accepted by the citizens and the state. They have been the ones working on the self-governance and self-regulation legislation. It's a very complicated area of activity. These democratic, liberal, market economy states, they didn't want to take this responsibility. They gave it into the hands of professional associations. So here it was a bit different. A few years before gaining independence, we had this administrative team. There was a state property issue. So this public activities and professional independence, it was difficult to fit into that system, and to change it during one generation is quite difficult. So I want to also point your attention that it's taken time, but it's still there is positive change we can see today. So back to professional standards. Professional standards is like a lighthouse. For us, it will define the criteria how we should attest or certify our colleagues. So it's important. The majority of professional standards, our federation is developing them together with its associations. It's the first step to this independence of the profession that we are already taken. Second, we are also, in this way or the other, we are harmonizing our legislation with the European one. So our direction is a membership in the EU. There are various areas of activity, but the medical care area and healthcare, we should focus on the standards and legislation and interactions that we have between our counterparts. So the cooperation, which is Ukrainian Federation of Professional Associations, with UEMS, for us it's extremely important in experience exchange. not copying the models, but really experience exchange. And we are really looking forward to Mr. Vasilios Papaloi's speech, and all colleagues in the presidium of the UEMS. They are very positive about our activities. And of course, for them, it's very surprising that there is war in our country. But the community and the medical community and the public and the ministries and the government, we are still working on our future despite all of the difficulties that we face today. So the fact that we voted today, it's a very it's like a basis for our future cooperation with UEMS. So we adopt these decisions together, jointly. And I hopefully the Congress will support this decision, and our next meeting with the European Federation, we will be able to submit the justified and this application with all the votes from the members of the associations to be members of UEMS. And also, we want to pay your attention. Mikhailo Borisovich mentioned in social network there are people who criticize the government and the doctors, but he mentioned one example. So other social networks, almost all of them, all people who had to leave Ukraine and go abroad, and even their new friends of those, they are so positive with the feedback about our healthcare system, about our doctors, even though there are difficult procedures. They consider the medical care in Ukraine to be the best out of all the countries where our people are now located in. So it's not about praising ourselves, but how we were trained, how we were brought up, how we and this oath of the doctor, the way we treat it, it's working, even though the financial financing is not enough these days for our doctors to feel like they are on the same level and they are as honored as foreign doctors. So still the feedback of people who could compare the medical care in other countries, now we know that we are on the right way. Of course, this way is quite long and it's quite difficult, but still, thank you for your attention, and please allow me to I want to perform my function of a moderator, and I would like to invite the next colleague to take the floor. Do you have any questions, dear colleagues, the questions that you would like to ask to our honorable speakers in the hall? Does anybody have a question? Yes. It means that you support the accession and the development of self-governance. But today in our room at the summit, we have more than 650 people. As of now, 200 people are listening to us online. So I hope that today we will have a very fruitful day, and tomorrow also the summit and the Congress. I was also notified that Mark Hermans is a representative of Professor Papalois, but we will ask him to give his speech at his Congress of the Delegates of the Federation of Professional Medical Associations. Now I would like to give the floor to Vyacheslav Kaminsky, the professor, please.
So, thank you. First of all, I'm sincerely grateful to our speakers for finding time and opportunity to join us today and speak before our Honorable Congress. I'm not going to repeat the things I'm going to tell you during the Congress. I am grateful to give the presidential powers to Vasil Vasilievich, and I hope that our future joint actions will be focused on strengthening our positions and our standing. Thank you so much. I'm grateful to everyone, and I'm grateful to our speakers, people who spoke at the first plenary session. We're about to have a brief 5 to 10 minutes break. I will kindly ask the delegates of membership associations and the federation, while the rest of participants are invited to go to the opposite hall for exciting second panel on education and continuous professional development and research cooperation.